Good morning. How many of you?
Morning.
Yes, can you all hear me?
Yet?
Yes. Can you see the screen?
Yet.
How many, if we cannot? Yes, I'll be recording and I'll make sure you'll get the link. Yes, can you all see? So if you can see, so we have 2,267 altogether for part A, eMRCS, and we'll be solving it category wise. Yes, most of these 609 you have already solved. I think 400 or approximately you have already solved. But today we'll go very quickly. And if there is any problem anyone wants to discuss, then we can discuss as well. Yes, and I cannot, in today's, I cannot see how many of you are there, how many participants I have, but anyhow. When you're all ready, then tell me, I'll start.
Ready?
Yes.
I'm ready.
Good. Yes. Read the question and tell me the answer. Does anyone wants to read it out?
I can see anything, ma'am.
No, you can't see. Sorry. No, sorry. Flexion of the fingers is impaired, right? So in your opinion, there is no sensory loss, and imaging confirms the displaced forearm. So what do you think, in your opinion, which nerve is injured? There is deformity, there is swelling, inability of flexing of the fingers. So what would be the?
Yes.
Yes. How about anterior introsius nerve? Because it's there's no sensory impairment, and as far as you know, anterior introsius nerve is total motor. Yes. Should we go with it?
Madam, can you repeat the question, please?
Yes, it's in front of you. We're just at the first, on the first question. Do you want to discuss? Or have you understood so that we could go to the next one? Yes? Should I go to the next question?
Yes, sure, ma'am.
Yes, now read. Which of the following nerves supplies the skin on the palmar aspect of the thumb? Does anyone want to tell me the nerve supply of the palm? Hello, you people are going
Mainly
for the
from
exam.
yes, madam. Mainly from the median nerve and
And?
partly from the anterior process nerve.
Yes. And what about the thumb? I'm not asking for the dermatomes today, right now, but I will be discussing those as well, because mostly they ask for the middle finger or for the little finger. So they do ask for the dermatome, which dermatome supplies the middle finger or the little finger, or yeah, so you have to know that as well. How about median nerve? You said median nerve. Yes.
Yes, madam.
Next.
Although I'm not able to see the questions on my mobile.
Why?
On the I'm not really sure. I'm trying to figure it out.
You cannot see my screen.
No, madam, I'm not able to see. I can just see your profile DP, but not the questions.
Why not? I'm sharing.
I'm also seeing your profile
Figure it
picture.
out.
So why you're not telling me? Now you can see my screen.
Oh, yes.
It
Now
wasn't
I'm seeing the
even.
question.
That's why I was thinking, how come no one is answering?
Yes, madam. Yes, madam. Now we can see the questions.
Question.
Sorry,
Yes.
so I'll go behind. I was already discussing the question and I was thinking you can read and you can see.
All right. So
This
we
is
start from the first question itself again,
yes,
right?
yes. If you want me to go back, I'll restart it because we're only 2 questions away.
I guess that would be a good thing, ma'am. If it's okay with the rest of them.
What do you all say?
This is the first question.
This is the first one. Yes.
Yes. Yes.
Emergency.
Anterior interosseous nerve supply
Yeah.
only motor, not
It's
involved
only
sensory
motor.
function.
Yes.
Yes.
It has no sensory fibers.
Yes. Median nerve supply, the 3.5 finger of the radius of the palm.
Yeah.
Just both sensory and motor.
Yes. Median is both motor and sensory. Maybe here I have, here I have the description of anterior interosseous nerve. You can read it quickly and then we'll go for the next question.
Ma'am, may I ask if the posterior interosseous nerve is also purely motor and not sensory as well, right, ma'am?
It's motor, but there is branch of radial nerve.
Median, yes.
Okay.
Yes. Next.
Yes, ma'am.
Please.
Yes. This question I was asked. That's why you couldn't see anything, but none of you told me. I asked if you could read the questions.
This. The answer is a median nerve.
Yes.
Because median nerve supply 3.5 finger of the radius of the finger.
You can read the literature of median nerve.
Yes.
Yes.
Also supplying a flexor compartment.
Yes.
Not external. Yes.
Can you repeat what you just said, sir?
Dr. Minzin, can you repeat?
Median nerve supply.
Yes.
Yes. Median nerve supplying 3.5 finger of the radius of the palm. It is supplying both sensory and motor.
Yes.
Right, ma'am.
It's
Right.
supplying flexor compartment.
Right. Right. All right. All right.
And this is most important. You have to know what happens when median nerve is damaged at the waist. There'll be carpal tunnel syndrome. There'll be paralysis and wasting of thinner eminence muscles and open scoliosis. Sensory loss of palmar aspect of lateral 2.5 fingers. Lateral 2.5, okay? There'll be sensory loss. And when it is damaged at elbow, this is important, you have to know. So all of the above, in addition, unable to pronate forearm, weak wrist flexion, ulnar deviation of the wrist. And for the anterior interosseous nerve, branch of the median nerve, leaves just below the elbow, and there results in the loss of pronation of the forearm and weakness of the long flexor of the thumb and index finger.
In the finger, yes.
Yes?
Yes, ma'am.
Now we'll go to the next one. Yes, now you can tell me the answer.
So internal iliac node, I think.
Which one?
Internal iliac nodes.
Iliac
Okay.
nodes, yes, C.
All agree with this one?
Yes.
Yes.
Okay. Good. You knew it.
And ma'am, the just for discussion sake, the lower half of the vagina drains into the superficial inguinal. Yes, ma'am.
Yes,
The lower
it
half
says.
into the.
Yes.
Internal
Into
iliac
this.
node, yes.
Yeah. Internal and external.
Yes.
And then inferior aspect into the superficial environment.
Yes.
Next.
Next question, yes.
Yes, ma'am.
Yes. Jugular foramen. So what are the contents? Anyone knows by heart? Because eventually before exam you should know them on your tips. So tell me today.
I think A, hypoglossal nerve.
Yes. Anyone else? Yes? Anyone? True.
Okay.
Now you can read the contents of jugular foramen.
Right.
Inferior petrosal sinus, it's anteriorly, and intermediate is glossopharyngeal, vagus, and accessory nerves, all three of them. Posteriorly, it has sigmoid sinus. Yeah. Should we move on?
I can see the question.
Can you see now? I think I got disconnected.
Okay.
Oh, I see.
Yes. Should we move on to the next one? Are we all done reading?
Yes.
Thank you. Yes. So which structure are you going to encounter when you insert the needle for lumbar puncture? The first one, exactly, from outside to inside.
A.
Is everyone agreeing with A?
Supraspinous ligament.
Yes. Yes? Does anyone else
Yes.
want to?
Yes.
Yes. Please.
Yes.
Yes. Here, if you see lumbar puncture, whole process is given. It's the supraspinous ligament, which connects the tip of the spinous process and interspinous ligament between adjacent borders of the spinous processes. Then the needle passes through the ligament of the which may cause or give as when you're inserting, it's really thick and it's really hard. So when you go through it, it'll give away when a needle goes through it, and you'll feel it as well. And the second giveaway feels when the needle goes through the dura mater into the subarachnoid space, and that is when the CSF comes out and you feel it, right? You already know, and you've already maybe have done 100,000. So next.
Yes.
Right. Which of the following is most important in providing support to the duodenojejunal flexor? So you have to know the
Ligament of Treads.
which one?
E. Last one.
E.
Ligament of Treads.
Yes. Yes. You want to read below the duodenum quickly? Yes. Anyone wants to ask question?
Yes.
Tell me when you're done reading, and we'll go to the next.
Done.
Yes. Good.
Yes, done.
Good. Next question. Right.
Deep peroneal nerve.
Good.
Option B.
Yes. What is the
B.
nerve supply of the rest of the foot?
Cipronia now.
Yes. Excellent. Yes. Can read. Yes. Listen to the songs that like mute your mic. Yes.
Hello, everyone.
Yes.
I'm not sure if you can hear me. I just finished my audio setup here. Can everyone hear me?
Yes, we can. Are you going to talk about deep peroneal nerve?
No. I just joined and finished my audio setup. That's why I was asking.
Yes, we can hear you. Can you see the screen? Can you read what's being
Yes,
displayed?
I can. Thank you.
Yes, good.
Finish, doctor.
Yes, good. This is it, right? No, little bit is left at the bottom. Yes. Next.
Yes.
Good. Now tell me. Lady is going axillary sentinel lymph node biopsy. Which structures are you?
Intercostobrachial nerve.
Yes. What about
B.
all others?
Intercostal brachial nerve. Option B.
Yes. Yes. Everyone agree with this?
Yes.
Good.
Yes, ma'am.
Yes. This is the boundaries of axilla. These are also, if not directly, but then indirectly are asked, and you have to know the contents of axilla as well. So, should I move it below so you can read the whole axilla? Yes. So the basic content is long thoracic nerve, thoracodorsal nerve and thoracodorsal trunk, axillary vein, intercostal nerve, and the lymph nodes. You can just remember these 4 or 5 structures on tips. And the boundaries are also easy. Medially, you have the chest wall. You can just imagine in the striatus anterior. Laterally, you have humeral head. Floor is by the subscapularis, and the anterior aspect is by the lateral border of pectoralis major. And fascia is just the clavipectoral fascia. Just imagine when you're reading, then you'll remember it. Otherwise, like if I plan beforehand, then I can just open some pictures as well, and then I'll show you next time. Yeah, next. Yes, are we all
Yes.
Yes.
Next. Yes, please.
Yes. iPhone. So which of the structures listed below is least likely to be divided? And remember, in it's 2/3 between umbilicus and pubic symphysis. So what structure is not present in the below
Posterior
1/3?
lamina of rectus sheath. Option
Yes.
E.
Yes, it's deficient
Yes.
below.
Below the arcuate line.
Yes.
Yes.
So incision lies at this level and below the arcuate line. This posterior lamina is deficient. And this is the rectus muscle. You can read more about it. It starts from the posterior margin, anterior sheath, and it's composed of external oblique, epineurosis, and the costal cartilages are posterior to it. Below this muscle is directly related to transversalis fascia and peritoneum, as you could all see here. And that is the point where inferior epigastric vessels enter the rectus sheath. Very important.
Yes.
Yes. Yes.
Next question, please.
Yes. What is the lymphatic drainage of ovaries? Everyone should know this on the tip. It's very important.
Or
Para-aortic.
aortic
C.
duct.
Yes.
C.
Yes.
Para aortic
Para-aortic.
duct.
Yes. Yes. Para-aortic. Lymphatic drainage is very important. Yes, iPhone, your phone is ringing. Yes, next.
Yes, please.
Six. I think 6.
You
Option
think
E.
or you're sure?
Sure.
Yes.
External compartment has. Yes.
It's 6.
There's a 6
Yes.
external
Yes,
compartment.
6 extensor compartments. 6.
Yes.
It's 6. Good. 6. So, what are the structures which are related to the extensor retinaculum? 6 compartments, you know, and then you have to know the structures as well. Can we quickly try to memorize them? Superficial and deep, like you divide them in 2, and then superficial 1, 2 are the veins, basilic vein, encephalic vein, and two are the nerves, right? Dorsal cutaneous nerve of the ulnar nerve and the superficial branch of the radial nerve. These are the two ones. And then comes a little irritating because voice quality is so good, you know. So every small noise transmits. So in the deep one, it's just the tendons. You have to know. 7 tendons, 8. Yes? If you can remember the radial artery, that's how passes between the lateral collateral ligament of the wrist and the tendons of abductor pollicis longus and extensor pollicis brevis. So you can see the tendons. Yeah. Next.
Yes, please. Next.
Where the right testicular vein drains.
In the inferior vena cava, B.
Yes. What about the
Inferior
left one?
vena cava.
What about the
Option
left
B.
one? What about
The
the
left one drains into the left renal vein, then the left renal
renal vein.
inferior vena cava.
All were talking at one time. I couldn't hear anyway.
The left one drains into the renal.
Yes, good.
Left renal vein, yes.
Yes. Yes. So this is the anatomy. Layers, very important, you have to know of the spermatic hole. Internal is derived from transverse face fascia. Cremastic fascia is derived from the facial coverings of internal oblique, and external spermatic fascia is derived from external oblique epineurosis. So from inside to outside, this is what you are getting, right? And then you can remember the contents of the cord as well. You should know them. Vas deferens, testicular artery, artery to the vas deferens. Cremastic, someone has speaker on. Cremastic artery, campaniform plexus, sympathetic nerve fiber, genital branch, and then lymphatics.
Access, yes.
Yes. This is just segment testes. These actually people, a lot of people come from RTA. So that's why these topics are important. So which of the muscles listed below is not innervated by the median nerve?
Adductor pollicis, I think E.
Pollicis.
Yes. E.
Good. This is
It's
supplied
abductor,
by the
not
ulnar nerve.
Yes.
And the medial two lumbricals, they are also innervated by the ulnar nerve. And the lateral two are innervated by what? Lateral two lumbricals?
Zoom app takana.
Medial
WhatsApp.
LOEF. Yes.
Median. Yes. We looked at the median nerve before as well. So here you have to know the lateral two lumbricals, opponens pollicis, abductor pollicis brevis, and flexor pollicis brevis. All these are motor branch supplied by the median nerve. And the sensory is over the lateral 2.5 fingers. Yes? Yes?
On the palmar aspect, projects proximally.
Yes.
Yes.
Right? Next question. We went through the damage here of the median nerve before. 44-year-old lady is undergoing an abdominal hysterectomy and the uterus is identified during the ligation of the uterine artery. At which side does it insert into the bladder? This is very important. Asked many times in exam.
Base.
Are you sure?
Base of the bladder.
Base of the bladder.
It's the base.
Ureter open into the base of the bladder.
Yes. about 5 centimeters apart from each other in the empty bladder, in the trigone, yeah, bladder trigone. So it's 25 to 35 centimeter long, muscular line by transitional epithelium. Thick muscular coat becomes like 3 muscular layers. It has retroperitoneal structures lying between is like 2 to 5 lumbar vertebrae. So if you have a stone and you take the X-ray, at this point you will see the stone impacted. If it is, yeah.
Yes.
So
Next.
blood supply.
And the uterine artery passes in front of it, right?
Yes.
Yes.
And you this is the blood supply segment wise.
Yes.
Right?
Yes.
Next.
Radial.
Radial nerve.
Yes.
Yes. I think option C.
Yes, because person has lost the
Extension.
extension.
Radial nerve.
Extensive.
Yes.
So it's radial nerve.
Yes. So radial is a motor nerve. Starts root value C5 to T1 from the posterior cord of brachial plexus. When it crosses the supinator muscle, it becomes the interosseous nerve.
Posterior. Yes.
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 These are the regions which are innervated by the radial nerve, and it's a main motor. So it supplies triceps and conus brachioradialis, extensor carpus radialis.
I think just like anterior interosseous nerve, posterior interosseous nerve doesn't
Yes.
supply the sensory portion.
No, it doesn't. But like in posterior interosseous branch exclusively, when it becomes
Yes.
after supinator, it supplies these all muscles
Yes. Yes.
in extensor compartment, and the sensory is only supplied by the radial
Radial
nerve.
nerve.
Yeah.
Yes. Yes.
And it supplies, it does not apply to the little finger and part of the ring finger. So 1.5, lateral 1.5 is not supplied by it.
Ulnar nerve.
Yeah. So these are the muscular innervation of the shoulder. It supplies the long head of the triceps. And when injured, it will affect the shoulder stability in abduction. And in the arm, it supplies triceps. If injured, then a person will have a loss of elbow extension. In the forearm, if it is injured, then it will be weakening of spination and pronation of the elbow. And elbow will be in mid-prone position.
Yes.
And here you can see the
Sensory supply.
dermatome. Yeah.
Yes.
So these 3.5 is supplied by median and on the posterior and anterior, and this is by the dorsal branch.
Yes.
Yeah. Next.
Yes.
Right. So what is the correct embryological origin of stapes? Some.
From the second dot.
Yes.
D.
E.
Second arch. What are the other structures which are derived from the second arch?
The facial nerve, the stapedial artery, and
Yeah. You would have to know them on tape. So start writing questions down and prepare them. Yeah. Below, pharyngeal arches. And here is the answer. What other things?
the muscles
Stapes,
of
sterlite
facial
process,
expressions.
lesser horn. Yeah.
Doesn't hold above body of Haiwan.
Yeah. There is nothing endocrine formed from the second arch. Arteries like inferior branch of superior thyroid artery, stapedial artery, facial nerve, and all the facial muscles almost. buccinatoplasma, plasma, all the famous ones, the common ones. Yeah, there's no fifth part, but for the sixth, it is also important because right pulmonary artery and the left pulmonary artery and ductus arteriosus arises from it. So when they ask, they don't ask the common one. They might ask you about the ductus arteriosus, origin of that in the exam. So this is, I think, covered in past test. Why Dr. Amira is not having sound? Am I audible to all of you? I think so because I'm getting replies.
Yes,
Yes,
madam.
madam. Yes, madam.
Yeah, next please. Next. Or you want to read more?
No, next.
Next.
72-year-old man develops a foot drop. Okay, after revision of now in this one, revision of total hip replacement is an important key.
Sciatic nerve A.
Sciatic nerve A.
So if it was a revision of total hip replacement was not written there, then what might have been the answer?
Common peroneal nerve.
Yeah, or yeah, but it's not in the option. So sciatic nerve is the largest from L4 to S3 in ventral rami. Yeah. Summary is like it's supplies articular branches to the hip joint, muscular branches are to the all the semitendinosus and membranosus, biceps.
Hamstring muscle.
Yeah.
Yes.
And but biceps femoris has two heads. What is the other head is supplied by?
The short head is supplied by the common peroneal nerve.
Yes, and long head by sciatic. Yes, these sort of peculiarities are asked when one muscle is supplied by two different nerves, so they can ask you one least common one, so that you have to know. Next.
There are two muscles in the lower limb, right? The adductor magnus and the biceps femoris.
Yeah, and they ask you about sartorius because sartorius is also quite important. Then Adductor Magnus they ask a lot because Hunter's Hunter's canal, it forms the boundary. So with that aspect they ask you.
Suprascapular artery, I think. It's a collateral branch of the axillary.
Would it be suprascapular or circumflex scapular?
No, circumflex of humeral is circumflex of scapula is not branch of the axillary artery. Suprascapular.
So in this one, subsequent collateral circulation is likely to result in reversal of blood flow in which of the vessel? You are saying suprascapular?
Yes.
All agree with this?
Scapular artery.
Yeah, I think so. But doctor says, everyone says suprascapular, so we will see. It's this one. You know? You have to know the branches because axillary artery, in every part, it gives accordingly. So first part, 1 branch, second part, 2 branches, third part, 3 branches. You have to remember
I think
them.
circumflex of humeral artery is a branch of the axillary artery, not scapular.
Yes, circumflex humeral in flow, but this is like this is likely to result in reversal of blood flow. It's they are not asking you about the branches directly, but like it says that it's it was easy question, but wording was made to make it difficult.
Yes.
So they are just basically asking about the branches, your knowledge.
Yes.
So it's a branch of scapular artery.
Yes.
Yeah. So these are
Yes,
the
we-
branches. You have to remember them.
yes.
That's why this part is in like highlighted. Yes, next.
Next, please. Yes, yes.
25-year-old lady presents with pain on the medial aspect of her thigh.
I think obturator. Obturator now. Yes.
Obturator nerve.
Oh, yes. It's compression in the obturator canal, I think.
Yeah.
Yes,
Large pelvic tumor.
yes.
This is the obturator nerve, which supplies medial compartment of the thigh, all the muscles. It is like also called, yeah. The obturator canal, it connects pelvis with the thigh.
Artery
Contains,
vein now.
yeah.
Yes,
All. This is
yes.
the location, you can see. This is obturator nerve. External iliac artery and the vein. And someone is asking question.
Yes.
Call me, waiting few seconds before answer. Call you?
Yes.
I don't understand, Dr. Hannah. Yes, next.
Next question, please. Yes.
Today it was first session, so we're going extremely slow, but next time please speed up. We should do one question in 1 minute. But anyway, the first time go slow, learn. That is the purpose. That's why I've subscribed the package. So it'll be like, there'll be a Zoom discussion will not disconnect. So 73-year-old presents with tumor at the central aspect of the posterior third of the tongue. So where the venous drainage would go and how would it metastasize?
Bilateral deep.
Bilateral deep
Yes.
Yes.
So this is the lymphatic drainage of, what about the tip of the tongue? Where the
Submental.
Submental.
Yes.
Excellent. You know it all. There's a good picture as well, which we can share it on WhatsApp afterwards. I'll share it. You can memorize it with that. Okay, 6-month-old child is brought to the surgical clinic because of non-descendant testis. What is the main structure that determines the descent?
Gubernaculum.
It's the gubernaculum.
Yes. So this is embryology.
And regarding this question, I have a query. In the fetal life, at what level do the testes lie in the abdomen?
In the posterior abdominal wall at the level of T12. This is what I know. You can correct me anytime, because my knowledge can also,
It's T12, right, ma'am? Has anyone heard about the level of L2? Because in a book or two, I've read
here it
that
says
the
L2. Located on
it's
the
L2, right?
Yeah, here it says L2. So I was wrong. Yeah, it's not T12, it's L2.
All right, thank you, madam.
Yeah,
Yes,
no
just
problem,
next question, please.
Yes?
Next question, please, ma'am.
Yes.
Please repeat the question again, if it's possible.
Repeat?
Okay, no problem.
Yes, you
Can you?
repeat. Yes.
Yes. Yeah, ask about the embryology of.
6-month-old child, and what is the structure which determines the descent of testis? It was gubernaculum. Yes?
Yes.
Okay.
That's okay, no problem. We're all here to learn.
I think lingual nerve.
Lingual?
Lingual. Yes.
Yes.
Okay. Yes, it's lingual. Third molar, up to 10% of patients undergoing surgical extraction.
Lingual neuroplasia. Yes.
Yes, lingual nerve. Branch of mandibular nerve
Yes.
from the posterior trunk. So next.
What
Yes,
about the
yes, Dr.
what about the perialveolar nerve? I think it is for lower jaw as
Yes,
general.
yes, yes.
Okay.
53-year-old man presents with unilateral hyperacusia. Which of the following nerves is least likely to be functioning normally?
Is it the vestibular cochlear now?
This is hyperacusia, and it's unilateral. So which nerve is least likely to be? If it was like more likely, then I think vestibular cochlear, but the question is least likely.
Least likely.
So I think it's facial nerve.
Facial. Yes.
Right,
Yes. I think all.
sorry. Facial nerve, yes.
Damage to the nerve in the bony canal may result in impaired innervation to stabilis, and therefore sounds are no longer dampened.
Dampen. Yes.
Yeah. So
Why not vestibulocochlear?
yes.
Why not vestibulocochlear?
But that is
Least likely.
when you are asked, you have to
Least
read
likely.
the question. It's the least likely.
Least likely.
When
Yes.
it is more likely, then you can go for the vestibular cochlear. But the question today was asking about the least likely.
Yes.
Yes.
Yes,
ma'am.
Yes, man.
So these are the facial canal path. It is also asked because the canal, it passes through the superior to the vestibule of the inner ear, and from that medial aspect, the middle ear, and it contains the wider geniculate and 3 branches, and then it comes out from the styloid foramen. And this is really confusing. People mix it up. From where it enters from subarachnoid path, and it exits from styloid foramen. So these are the questions which they ask, and they try to confuse you. So
Yes.
you have to just remember the path. And in
Yes.
branches as well, when it comes out and in parotid, it gives just 5 branches, which you can just say, spread the hand on your face and you can remember them accordingly. And then you'll know the territory which is supplied by each branch of the facial nerve as well. Yes, next.
Yes, next, please.
What is the most important structure involved in the sport of uterus? This is also
Central perineal canal.
Yes, good.
Yes.
Central perineal canal.
Very frequently asked.
Yes.
So these are the supplies and of the uterus and all the next. 43-year-old typist presents with pain at the dorsal aspect of the upper part of the forearm. She has complaints of weakness when extending her fingers. On examination, triceps and spinator are both functioning normally. Okay, so there is weakness of most of the extensor muscles. However, there is no sensory deficit.
Posterior interosseous.
Posterior interosseous.
Yes.
Yes. Very good, excellent. Now you all know the answer. Yes, because posterior sensory deficit was Next, or you want to read the posterior interosseous?
Go to the next.
Next question, please.
The surgical section specimen is analyzed histologically. The pathologist comments that the periphery of the resected specimen has optical cells. So these structures are identified. Yes?
I think parathyroid.
Parathyroid.
Yes, parathyroid. Good, excellent.
Yeah.
Oxyphil cells are typically found in. Yes?
Yes.
Someone answered thymus. But the answer to thymus would be Hassel's corpuscles are ideally thymus.
Yes. Excellent. Good. This is the embryology of parathyroid gland is important, which can be asked as well. So the superior or upper parathyroid glands, they are formed from which pharyngeal pouch?
The superior is formed by the third, the fourth, and the inferior is formed by the third pharyngeal.
Yes, good. This is what you have to know. What about the blood supply?
Superior is from the superior thyroid artery from the external carotid artery, and the inferior is from inferior thyroid artery.
Yes, excellent. And these are the relations.
And the superior one is stable in its position. The inferior one is variable.
Yes, excellent. And this is the relation you have to know. Laterally, it has the common carotid, medially recurrent pharyngeal nerve and trachea. Anteriorly, it has thyroid, and posteriorly, it has only the pretracheal fascia. Next.
Yes.
34-year-old man is injured by foam machinery and sustains a laceration at the spirolateral aspect of the popliteal fossa. Now, you have to know this is the spirolateral aspect, which yes, because common peroneal nerve at the neck of fibula, it divides into two nerves. Which ones? Which two nerves?
Deep and superficial peroneal.
Superficial peroneal.
Good. Excellent.
Next, please.
Yes.
Next question, please.
Yes. Who has noise at the... During block dissection of the groin, the sartorius muscle is identified. What is the nerve supply?
Anterior division.
Yes. Excellent.
Yes.
Anyone saying anything?
Miss Pichu scan. Femoral nerve supply.
Yes, it is supplied by the femoral nerve. So,
yes.
And why is it important? Because the middle third of the muscle, and it's the strong underlying fascia, forms the roof of the adductor canal. So that's why it is important, right?
Yes. Next question, please.
What is the lymphatic drainage of the male urethra?
Deep inguinal node.
Deep inguinal node.
Okay.
Yes. Right, now again, hyperparathyroidism, the right inferior parathyroid is identified as having an adenoma and is scheduled for resection from which of the following embryology?
Pharyngeal pouch.
The fourth pharyngeal.
Inferior is...
Sorry, inferior, yes.
This is inferior, you know?
Third pharyngeal pouch.
Third pharyngeal, sorry, third pharyngeal.
Opposite. Inferior is from third and superior is from...
Superior is a fourth pharyngeal pouch, yes.
Did Dr. Ali Fateh, Dr. Al Fateh Ali, yeah, there is too much noise behind you. I'm sorry.
Okay. There is not noisy?
Yeah, in background, I don't know. I just muted you to see, and it was like became calm.
Because I was muted already. I don't think so.
Sorry. Yeah. Okay. 23-year-old man falls and slips at a nightclub. A shard of glass penetrates the skin at the level of medial epicondyle. So, which nerve at medial epicondyle will least likely to occur? So, which sculi will least likely to occur?
Claw-like appearance.
Claw-like appearance of
Claw-like appearance of the
Claw-like appearance.
So it's which nerve? Ulnar nerve.
Ulnar nerve.
Yes.
Ulnar
So
paradox.
what is ulnar paradox? Can anyone tell me ulnar paradox?
More proximal injury to the ulnar nerve. Just least likely.
There is an injury in the wrist at the level of the clawing is much more pronounced. However, when the injury occurs proximally in the forearm or the upper part of the forearm or the elbow, the deformity becomes less evident. That is why
Yes,
it's called as
correct.
ulnar paradox.
Excellent, excellent, wonderful.
Yes.
Yes, that's it. And the first dorsal interossea is also supplied by the ulnar nerve, so it will be affected as well. So
Yes.
or you want to read ulnar nerve? You've summarized it very well. Here are the effects of injury. Here, damage at the wrist and damage at the elbow. Flowing is less. Yeah. And there'll be the radial deviation of the wrist.
Yes.
Yes.
Okay.
Yes, this is important. 56-year-old man is undergoing a superficial paradox.
For paratectomy.
Retromandibular vein. Retromandibular vein.
Retromandibular vein.
Line. Which one?
Retromandibular vein.
The retromandibular vein.
Most superficial.
Facial nerve.
Facial nerve.
Yeah, you have to
first facial nerve, then the retromandibular vein.
Yeah, most superficial is facial nerve, and then
Yes.
it will be retromandibular vein.
Oh.
Yes.
Yes.
Retromandibular.
It's the most superficial
Slightly
structure
deeper
in
to
the
this.
parotid gland, and slightly deeper to this lies retromandibular vein, with the arterial layer lying most deeply.
Most deeply.
Yes.
Yes.
So you have to remember this.
Yes.
And this is the parotid gland. We didn't read this before, did we? So these are the facial nerves branches. Apart from that, external carotid artery, retromandibular vein, and auriculotemporal nerve as well. These are the structures which pass through the facial parotid gland.
Yes.
And
Yes, ma'am.
where the duct opens.
Opposite the
second upper molar teeth.
Second
Because
upper molar.
this is also asked. It's important.
Stanson.
They confuse it with the submandibular glands. Where the duct of submandibular gland opens?
Besides the frenulum.
Yes.
Just lateral to the frenulum.
Yes, good. And what is the name of the duct for submandibular gland?
Watson's duct.
Watson's.
So parotid is above. So Stenson's duct is the name. Whereas submandibular gland is below, so name of the duct is Watson's. Starts with W.
Yes.
So remember it like this. You have to, syllabus is long, so you have to give yourself.
Can I ask a query over here?
Yes.
During the September exam 2019, there was a question wherein the question was something about neural invasion of the parotid gland or something like that. Hello?
Yes.
Yeah. So the neural invasion is due to the pathology is due to adenoid cystic carcinoma, right, ma'am? But there was an option of Bell's palsy also in the question, and when I discussed it later on with other colleagues, they said because there was an element of pain not involved, so that's why the question would more likely be Bell's palsy rather than adenoid cystic carcinoma, because apparently in adenoid cystic carcinoma there is a lot of pain that patient has, and that question particularly mentioned that patient has no pain, and hence the answer would be Bell's palsy. It's just out for discussion.
But in adenoid carcinoma, but in ethnic adenoid carcinoma, there is perineural invasion is present. That
yes, it did mention that there was neurology involved. However, the question also mentioned that there was no pain, absolutely no pain. Hence, the answer was Bell's palsy and not adenoid cystic carcinoma. I had also answered adenoid cystic carcinoma.
But how can we justify this part that if there is a perineural invasion and at the same time you are saying it is Bell's palsy? In Bell's palsy, we don't have this perineural invasion.
No, it's not that I am saying that. Actually, I also answered marked adenoid cystic carcinoma. However, a lot of friends, a lot of colleagues were ENT people, and when I came out, they were saying that it's Bell's palsy.
It can't be.
So that's where my confusion lies.
Yeah, most commonly they ask about adenoid cystic carcinoma. Depending upon the age of the patient, depending upon the history, if patient is smoking or not, then depending upon history, what they have treated. So we'll come to those questions. We'll discuss them in details. Since I was not present, so I don't know exactly how the question was formulated. But I will go through the recall of 2019 September, which one of my member had collected, and I'll see what he has written. And you can also check.
Yes, I'll also follow up with it.
Yes, thank you. And we can come back to that and we can discuss that again. That's why I thought,
Sure,
because
madam.
when you have discussions on WhatsApp, I can share more easily pictures and everything, but we cannot talk and we cannot discuss and we cannot clear the confusion. So I don't know if you're following or not, if you're understanding, just ABCD you're writing, I'm answering accordingly, but I don't know if it's fulfilling the purpose. Like now we're discussing, 17 people are listening. If I am wrong, someone else can correct me. So learning is going on. I know what you're understanding, you're understanding. What you're not understanding, we can always come back to it and we can discuss, right?
Right, madam.
33. So least likely to occur, which are the features?
I think complete
loss of
wrist flexing.
Yes, why? Yes,
because the
why?
ulnar nerve is still intact and there will be little flexion.
Excellent.
Yes.
This is what I had to
yes.
yeah. Flexor carpi
wrist
ulnaris
flexing.
was still functioning.
Function.
Yes. Median nerve we have
completely lost.
revised before, so we'll go next.
Hypoglossal.
The hypoglossal nerve.
Yes. What are the other structures which are present with hypoglossal nerve in the canal?
And atrotomy.
Yes, but what are the other structures which are present with hypoglossal nerve?
Sympathetic chain is there, but that is on the posterior side.
Retroauricular nerve and superior laryngeal nerve. These are all at risk. But if these two are not given, then only hypoglossal nerve. So you have to remember.
Yes.
Yes. Lies posteriorly. Sympathetic lies posteriorly.
That's what
so
I'm
it's
saying.
less prone to injury. Less prone to injury, right? In this procedure. But like careless surgeon can injure anything, any structure. So internal carotid artery, its relations in posterior, medial, lateral, and anteriorly, and in relation in carotid canal.
ये जो लिखते हो ना आप as told by broad by ये लिखा करो कि who is broad by कौन
I don't want to know what you're doing in your OPD. Who's telling me all this? Mute yourself, please. These are the branches, 6 branches you have to know.
Yes. Internal carotid artery. Yes.
Yes. And this is the vessel with relations. Yes. Next. 35. Right.
Capitulum.
Anatomy. Yes.
Yes, yes.
All should know this.
Capitulum.
Capitulum.
Yes, here. You can just look at this diagram quickly, which muscle is attached where, and then we can go ahead. I'm sure everyone can recognize radius and ulna. Yes?
Yes, ma'am.
Yes, yes, ma'am.
36.
Simpson fascia. Simpson fascia.
Simpson fascia.
Simpson fascia.
Yes.
Good. And it runs from C7 to first rib.
Yes.
Okay.
FX. Yeah.
Yes.
Yes. We'll go next. Lung anatomy. We'll come back to that later. Or you want to know now?
Common peroneal nerve.
Periphery, contact base of, and then structures. This is important that lungs run from 6th rib to 10th rib.
Yes, plural is at 8, 10, 12.
Yes. Now next.
Common peroneal nerve. Answer is D.
Yes, common parole.
Yes. Because this is the
Right,
keyword.
Davies.
Yes. Excellent. Yes. Next. Yes, you identified.
Psoas.
This is lesser trochanter. Yes.
Lesser trochanter, yes.
Yes. Psoas major.
P major. P major, yes.
What is the nerve supply of psoas major muscle?
Irritor.
Yes. It inserts in lesser trochanter and it is supplied by who will tell me?
Forget it.
Homework. This is homework for you. You will find it out and tell me. Okay, regards to internal nuclear vein, which of the following statement is untrue?
I think E. Bigger enough. Yes.
C. The terminal part of the thoracic crosses anterior.
C. Because terminal part of thoracic duct does not crosses anterior to the right subclavian vein. Yes.
All right, right. I'm exiting the group. I have to start a surgery. Thank you so much for your.
Thank you so much. Today we're going slow because it's the first time. We'll complete at 50 and then we'll start again in evening.
Membranous urethra.
Yes.
B. Membranous urethra.
Yes.
Membranous.
Part of urethra.
Membrane.
Yes.
Yes, very frequently.
It lies on its radial side.
A. Yes. Next.
Yes.
Next, yes.
Spiral groove of the humerus.
Radial nerve.
Yes.
Does it have anything else?
Profunda brachii.
Yes. So, scaphoid gets its blood supply from where?
Distal end.
Distal end.
Yes.
E. Distal end.
Yes.
Excellent, excellent, excellent. Right? What is the non-union?
Yes.
You know, it says if there is a risk of... Yes.
Non-union.
Yes.
Right.
G.
External oblique. G. External oblique aponeurosis.
Yes.
Transversalis fascia must be.
Yes. This is the inguinal canal. It's very important. You have to know the location. Above the inguinal ligament, the canal is only 4 centimeters, superficially located, anterior to the pubic tubercle. And the boundaries and the contents. Related, yes. Right. A patient sustains damage to the median nerve during a carpal tunnel release. Which of the muscles will be affected? So, carpal tunnel release is happening and median nerve got injured. So, which muscle?
B.
Adductor brevis.
Yes. Yes. This one is supplied by what?
Medial nerve.
Good. And the rest?
Ulnar.
Yes. Which of the following cranial venous sinuses is unpaired?
The superior sagittal sinus.
Sagittal sinus.
B.
B.
Do you want to read the remaining?
No. That's fine.
Yeah, these are the full list of the sinuses. Okay. Which of the following laryngeal tumor will not typically metastasize to the cervical lymph nodes? So,
Glottic.
why? Because it is avascular. Yes.
Ini fiber ni pura na. Apa pura je me?
Which of the following?
It's a D, the diagonal ligament. Medial.
Placinar.
Yes.
Good. It's frequently asked, so you have to know this. Which of the structures listed below accompanies the aorta as it traverses the aortic hiatus?
It's a thoracic duct, the B.
Yes, what else? Does it
Thoracic duct.
do they have
Thoracic
anything
duct.
else?
Yes, esophagus.
And
Esophagus vein, thoracic duct.
yes.
Esophagus.
What transmits that? This transmits the T12. What transmits the T10?
T10 is the esophagus and the vagus nerve.
And T8?
Vena cava.
T8 is vena cava and the right.
Good. Okay.
Obturator nerve.
Obturator nerve D.
Obturator medial side of the spine.
Yes. Good. Want to continue or we can end? Okay.
Right lower lobe.
Right lower lobe?
Yes.
Right lower lobe?
Yes. Why?
Because it is
wider
and
right ventricle.
Yes. Have you read the description?
Is the most dependent. Yes.
Yes, dependent and it's most wider.
But in lying position, it's something different, right? It's not like remember.
Yeah, I think so as well. Yeah, I think so. But I'm not clearly remembering the segments.
The segment.
Yes. Right dependent, right lower is.
Right inferior. It should be right. Right in lower lobe.
What's Japanese?
Which one? Okay, we'll come back to this later. Next, patient presents with severe vena cava obstruction. How many collateral circulation exists?
4.
Yes. Which ones? Does anyone know? Can anyone tell me?
Azygos.
And internal memory. Non-thoracic.
Non-thoracic.
With connection to the vertebral.
Vertebral, long thoracic, internal memory, azygos.
This is the severe vena cava. Brains, head, neck, thorax, upper limb, and a part of abdominal wall. That's how it is formed. And
I have a name for it.
Yes.
And I would like to share something. I read one
Pterygopalatine ganglion. A. Pterygopalatine ganglion.
A.
Okay.
A.
And someone was saying something. I was trying to.
Yes, I was speaking about obstruction. I read a question where it differentiate the obstruction before and after the azygos venous drainage.
Yes.
The differentiating point. So I read it that if obstruction is before the drainage, then there will be venous engorgement, and after the drainage, there will be different venous engorgement after the postal margin and after the second junction. That's the main differentiating point.
Okay. So parasympathetic fibers from lacrimal apparatus, it goes through pterygopalatine ganglia. And what about the otic ganglia? Which fibers go?
Parotid.
Yeah.
Otic for parotid gland.
Parotid gland. Yes, excellent. Which of the nerves listed below is directly responsible for the innervation of lateral aspect of flexor digitorum profundus?
Median nerve.
Median nerve. Median nerve. Median nerve.
Median nerve, yes. Anterior interosseous. See, motor branch was also given, so you have to be careful. It is supplied by the median nerve, but from the anterior interosseous branch.
Yes.
The median nerve divides the conator trace, right? And gives the anterior interosseous?
Yes. These are the flexor muscles. I didn't understand your question, doctor. Actually, here
I asked the median nerve divides above the conator trace and gives the anterior interosseous branch?
Yeah. Yes, someone just left the group. There was Dr. Sagar. If he's still there, he can join the group.
Hepatic artery. Hepatic artery.
Hepatic artery.
Yes, hepatic artery. So we're not going to confuse it with the cystic bile duct, with that of the cystic duct. Yes. What vessel is the origin of the middle rectal artery?
Internal area.
Right. What about the superior rectal? It's
From the inferior mesenteric.
Yes, inferior mesenteric, and the inferior rectal is branch of
the internal pudendal.
Yes, this is important. You all should know this.
All right.
Right. Which of the structures listed below are most closely related to axillary nerve?
Posterior circumflex humeral. Posterior circumflex humeral.
C.
Posterior circumflex humeral.
Posterior or anterior?
Posterior. Yes.
Posterior. Posterior circumflex humeral.
Yes. Okay. Thyroidectomy.
In the upper half.
Yes.
Upper half. A.
Good.
Answer cervically. C1,
Yes.
C2, C3.
In the lower half. Yes. 7-year-old boy presents with the right iliac fossa pain.
Is a visual intestinal duct?
From the midgut.
That E.
Midgut.
E. Midgut.
E part, midgut.
Yes. How do you define where is the demarcation for foregut, midgut, and hindgut? Who can tell me?
Foregut is up to the major
esophagus to the duodenum.
And
First, foregut is from
duodenum
ligament of Treats. Ligament of Treats.
Okay.
And from second midgut start second from ligament of Treats to the transverse colon, mid part of transverse colon.
Okay. Median 2/3 of the transverse colon, and
yes.
The foregut, it's in the second of the second part of duodenum, where the
major duodenal papilla opens.
Yes, opens. Yes, and the rest is the hindgut.
Okay, thank you.
Yes. What are the reticuloendothelial cells?
White pulp.
The white capsule. White
bulb.
White.
D.
Within the
White pulp.
D.
Yes,
D.
yes, white bulb.
Good, excellent. You all know this. You wanted to read the spleen function?
No.
We can move on.
I think we should
Yeah,
skip this part.
you know this mostly. Quality of erythrocytes.
Antibody production and maintenance.
Yeah, removal of antibody for bacteria and blood. This is the function. Yeah.
And there is a platelet pooling function also. I don't know what this is.
Platelet antibody production.
It is not written there, but I think there is another function of platelet reservoirs, as I remember.
Maybe because it's overwhelming in sepsis. So
Yes.
yeah, antibody prophylaxis. Okay, I'll read through it afterwards. I don't know. 22-year-old woman has recently undergone a surgical excision of submandibular gland. She presents to the follow-up with complaint of tongue weakness, the ipsilateral side of the surgery. So, he went to
Hypoglossal now.
Sure.
Inferior villa.
No, it must not be. It was hypoglossal.
So, you have to know these three nerves, like if there was marginal mandibular branch of the facial nerve or the lingual nerve. But lingual nerve was there, but hypoglossal nerve was also there. So you have to know three. Yes. Process of ipsilateral, so that's why it was. Yeah.
No, lingual nerve is mostly at this at risk.
Yes, lingual is mostly at risk, but since they said.
But this is a sensory, yes, rather than motor, yes.
Motor, yes. Because it was muscular weakness, and hypoglossal is muscular for tongue muscles.
Yes. Sensory branch to the lower lip, right? Or angle of mouse.
You decide to take an arterial blood gas from the femoral artery. Where should the needle be inserted?
Midpoint.
Midpoint.
Yes. Which one is the midpoint?
A.
D.
A.
A. Sorry.
A.
B.
Not the inguinal ligament. It's mid-inguinal point.
Mid-inguinal point and midpoint of inguinal ligament. You know, this is very important.
Yes.
There's difference.
Mid-inguinal point is actually the midpoint of the inguinal ligament.
Yes.
Mid-inguinal point is
that's for the
femoral artery.
Yes.
So friends, I'm gonna have to leave because I'm gonna go for lunch.
Yes,
and
thank
there's
you.
gonna be lots of noise.
We'll also stop at 70 because this is first
Okay,
session.
thank you very much. It was very nice solving
you.
the questions with you. Bye-bye.
Bye. 67-year-old man undergoes carotid endarterectomy and seems to recover well following surgery. When he is reviewed on ward postoperatively, he complains that his voice is hoarse. What is the
Vagus?
Damage
to vagus.
Yes.
Vagus.
Yes.
Recurrent laryngeal nerve.
Laryngeal.
Which has led to hoarseness. Yes. Man has inguinal hernia. Following structure must be divided to open surgery to gain access to the inguinal.
Oblique aponeurosis that forms the oblique aponeurosis.
Yes.
External oblique aponeurosis.
External oblique aponeurosis. B.
Yeah. Yes. So everyone should know this. Which muscle initiates abduction?
Supraspinous.
To what
0 to 15 degree.
Yes.
0 to 15 degree.
0 to 15 and deltoid complete.
Yes. Deltoid up to 90.
Yes.
Yes. To 90.
Which of the following nerves is most commonly damaged during the superficial paradigm?
Greater auricular nerve.
Yes. And for submandibular, it was facial.
Yes, yes.
Exactly.
Yeah.
It was hypoglossal, I think.
Yes. 34-year-old man is shot in the posterior inferior aspect of the side. Posterior inferior. Okay. So which of the following is lateral aspect of the popliteal fossa?
Common peroneal
nerve. Yes. Which structure is most deep in the
popliteal artery?
Yes.
Gluteal artery.
Yes.
No, it is common peroneal. Most lateral common peroneal.
Yes, but the deepest is common popliteal artery.
Okay. Okay. Deepest is popliteal artery.
Yes.
67-year-old man has an abdominal aortic aneurysm which displaces the left renal vein. Which branch of the aorta is most likely to be
Superior mesenteric artery.
Okay.
Superior mesenteric artery.
Superior mesenteric artery. B. B, yes.
Undergoes uncomplicated tonsillectomy for recurrent.
Glossopharyngeal nerve.
Glossopharyngeal.
Yes. Glossopharyngeal.
Yes. That is why you have rougher pain in the ear as well.
Yes.
Yes, 12-year-old boy undergoes surgery for recurrent mastoid infection. Post-operatively, he complains of all altered taste sensation. So which?
Greater petrous.
Chorda tympani. Chorda tympani.
Yeah, branch of?
Facial nerve.
Good.
Facial nerve.
Good.
Chorda tympani branch of the facial nerve.
Yeah. This is chorda tympani.
Yes.
Yes. This is you can see arising it from facial nerve. So
yes.
Yes, this is facial nerve. It's arising, and this is the tense portion of membrane tympani.
Membrane.
Yeah. Should we stop here because it was the first session and we went really slow? It has been, or I can solve 30 more if you want in the next 30 minutes. Okay, let's finish 30.
I think.
Yes, say it.
I think we should stop.
Yes, we should stop. I agree because the last person I also said will stop at 70. So thank you so much. I will make sure the link is available for those who couldn't join. But from next time, we'll go quickly. We'll go little in more speed so that we can cover at least 100 in 1 hour.
Sure.
Because when I post copy paste, then my record is that I cover 75 in 1 hour. So 539 are left, and we have to cover them as soon as we can, because this is the total amount of eMRCS. And before exam, I normally try to cover eMRCS 3 times. So you have to speed up accordingly. In evening, 4 p.m. UK time, we'll start with past test online, exactly like this. Okay. So study has begun.
Okay, mom.
You have to get serious. Yes.
When will be the next session, madam?
4 p.m. UK time.
4 p.m. UK.
Okay. 4 p.m. UK. Okay.
Yes.
Thank you, mom.
Because afterwards I have to go with the group B, so can't have it earlier. Thank you so much.
Thank you very much.
Thanks, man.
Good session.
Thank you.
The rest.
Thank you.